So you're taking high blood pressure medication, but do you really have high blood pressure? Are you sure you do? And maybe you truly do, but there are a few things that need to be taken into consideration. First of all, understand that a lot of people who are placed on a low sodium diet because of high blood pressure really don't have a problem with sodium. The problem is that they were low in potassium. The sodium-potassium ratio matters as much as the sodium does, sometimes even more. In many cases, if they would just increase their intake of potassium-rich foods, the blood pressure would normalize. I normally advocate eating potassium-rich foods rather than taking a potassium supplement because you got to be careful. You don't want to get too much potassium. And a lot of people who are on low sodium diets have health problems related to sodium deficiency. So many people, and unfortunately many doctors, consider sodium to be some kind of hazardous chemical or something. Sodium is an essential mineral. And as far as salt itself goes, we've taken our salt, refined it. It only has 2 minerals, whereas natural salt has at least 75 other trace minerals that our bodies can use, especially nowadays. The standard American diet, which is atrocious, is high in sodium and low in potassium. All the junk food, all the garbage that people are eating has a lot of sodium and very little potassium. So the ratio is unbalanced, and that can equal high blood pressure. There's a second thing to take into consideration when you've been diagnosed with high blood pressure: white coat syndrome. A lot of people know what that is. A lot of people, just being in a doctor's office, just having someone check their blood pressure is stressful for them, and it makes their blood pressure go up. And a lot of health professionals will diagnose high blood pressure, hypertension, by taking blood pressure just one time. That's not a good idea. You may have had a rough morning. You may not have slept well the night before. You may have gotten into some heavy traffic on the way to the doctor's office. You may have been in a hurry, didn't want to be late for your appointment, any number of things. And then, of course, there's the white coat syndrome. So all those things can cause the blood pressure to go up temporarily. But under ordinary circumstances, the blood pressure is normal. So it's a good idea to check it at home. Do multiple checks just to make sure. I just wrote an article for my newsletter on high blood pressure, and it discusses quite a number of natural things that can lower blood pressure, have been shown scientifically to decrease blood pressure. And all of those things are healthy for the body, as opposed to high blood pressure medications, which have a lot of side effects. And many people are taking medications for the side effects of the blood pressure medication. So I don't think your doctor is going to be upset if you normalize your blood pressure by using natural things that have beneficial side effects as opposed to harmful side effects.